Panic disorders, unraveling the mysteries and pathways to relief. Panic disorder stands as a significant subset within the realm of anxiety disorders, marked by recurring panic attacks. These attacks, characterized by sudden and overwhelming fear, manifest with physical symptoms akin to the body's natural response to imminent danger. Understanding panic disorder. Panic disorder unfolds as an anxiety disorder featuring unexpected, repeated episodes of intense fear. During a panic attack, individuals experience physiological responses mimicking the body's preparatory fight or flight mode, even when no actual threat exists. Common symptoms include increased heart rate, muscle tremors, sweating, and a sense of impending doom. Some individuals may also encounter feelings of detachment from reality during the peak of a panic attack. The frequency and impact. The frequency of panic attacks varies among individuals, with some encountering several episodes daily, while others may experience them at more extended intervals. The unpredictable nature of these attacks, including their occurrence during sleep, contributes to persistent anxiety, fostering an apprehension that an attack may transpire at any moment. This heightened anxiety often leads to anticipatory fears, potentially culminating in agoraphobia, a fear of situations where escape might be challenging or embarrassing. Exploring causes and risk factors. Researchers posit that panic disorder arises from disruptions in brain pathways regulating emotion. Additionally, a hereditary predisposition may contribute, with evidence suggesting a genetic basis for the disorder. Close relatives of individuals with panic disorder exhibit a heightened risk of developing the condition, emphasizing the role of genetics. Moreover, studies hint at the impact of early life stress as a potential trigger for panic symptoms. Demographic patterns. Panic disorder displays demographic patterns, with women being twice as likely as men to experience it. Furthermore, women are 3 times more likely to develop agoraphobia, a common accompaniment to panic disorder. On average, symptoms emerge around the age of 25, although the disorder can affect individuals of all age groups. Associations with other psychiatric issues. Panic disorder often coexists with other psychiatric problems. At the time of diagnosis, over 90% of individuals with panic disorder exhibit comorbid conditions such as major depression, other anxiety disorders, personality disorders, or substance abuse issues. Symptoms of panic attacks. A panic attack is characterized by at least 4 of the following symptoms: palpitations, heart pounding, or a rapid pulse; sweating, trembling or shaking; breathing difficulties, such as shortness of breath or feeling smothered; feeling of choking; chest pain or discomfort; abdominal discomfort, upset stomach, or nausea; feeling faint, dizzy, lightheaded, or unsteady on your feet; feeling unreal or detached from yourself; fear of losing control; fear of dying; numbness or tingling in arms, legs, or other body parts; chills or hot flushes. Between panic attacks, individuals with panic disorder often grapple with persistent worries, modifying their behavior to avoid potential embarrassment or loss of control in social situations. Diagnosing panic disorder. Due to the physical symptoms mirroring other medical conditions, individuals experiencing panic attacks may initially consult primary care physicians. Comprehensive medical examinations aim to rule out conditions such as heart disease, asthma, epilepsy, or hormonal abnormalities that could mimic panic attack symptoms. Family and psychiatric histories, along with assessments of stress levels and substance use, contribute to a more accurate diagnosis. If panic disorder is suspected, a referral to a mental health professional becomes essential for a thorough evaluation. Duration and long-term outlook. Untreated panic disorder can persist, significantly impacting an individual's life. However, the disorder is highly treatable. Proper care, encompassing both pharmacological and psychotherapeutic interventions, often leads to long-term symptom relief. Preventing panic attacks. While prevention of panic disorder remains elusive, individuals diagnosed with the condition can take steps to reduce the frequency and intensity of panic attacks. Lifestyle modifications, such as limiting caffeine and alcohol consumption, may mitigate triggering factors. Timely diagnosis and appropriate treatment interventions are pivotal in preventing the exacerbation of symptoms. Treatment modalities. Various treatment options exist for managing panic attacks. Antidepressants. Despite their nomenclature, many antidepressant medications prove highly effective in addressing anxiety, a category that includes panic disorder. Frequently prescribed for generalized anxiety disorder, selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, are often the initial choices. Other antidepressants with distinct mechanisms of action, such as mirtazapine, Remeron, venlafaxine, Effexor, and duloxetine, Cymbalta, also demonstrate efficacy. While older antidepressants like tricyclic antidepressants, for example, nortriptyline, imipramine, and monoamine oxidase inhibitors, MAOIs, for example, phenelzine, remain effective, they may carry more pronounced side effects. Given the delayed onset of action of antidepressants, doctors may concurrently prescribe fast-acting benzodiazepines for immediate relief. Benzodiazepines, operating on the brain's fear response system, benzodiazepines represent another class of drugs utilized to manage anxiety symptoms. Pioneered by chlorodiazepoxide, Librium, and diazepam, Valium, in the early 1960s, newer benzodiazepines like clonazepam, Klonopin, and lorazepam, Ativan, offer a reasonably safe and prompt alleviation of anxiety symptoms. Often administered in the initial weeks of treatment while awaiting the full effect of antidepressant medications. These drugs are typically prescribed for a limited duration due to the potential for the body to develop tolerance. Gradual cessation under a doctor's guidance is advised to mitigate withdrawal reactions. The FDA mandates stringent warnings on all benzodiazepines regarding the risks of dependency, addiction, and withdrawal symptoms, emphasizing the crucial avoidance of combining these drugs with opioids, as it can compromise respiratory function. Cognitive therapy, as a non-pharmacological approach, cognitive therapy aims to assist individuals with panic attacks in recognizing the irrationality of fears triggering panic. Therapists specializing in cognitive therapy often impart specific techniques to manage and navigate panic attacks successfully. Behavior therapies. Various behavior therapies complement medication regimens and include in vivo exposure, a gradual exposure to fear-inducing situations to reduce anxiety over time. Respiratory training, techniques focusing on breath control as a means to combat panic. Applied relaxation, a method teaching patients to control anxiety levels through muscle control and imaginative relaxation. For many patients, the most effective approach involves a combination of medications and cognitive or behavior therapies. Impact on daily life. Panic disorder, with its unpredictable and intense panic attacks, can significantly impact various aspects of an individual's daily life. Work life. Productivity and performance. Panic attacks may hinder concentration and productivity at work. Individuals may find it challenging to focus during episodes, potentially affecting the quality of their work. Absenteeism. Frequent panic attacks can lead to increased absenteeism as individuals may feel compelled to avoid work during periods of heightened anxiety. Career progression. The persistent fear of panic attacks may deter individuals from taking on new challenges or pursuing career advancement opportunities. Relationships. Interpersonal dynamics. Panic disorder can strain relationships as partners, friends, and family members may struggle to comprehend the intensity of panic attacks. Communication may become challenging during episodes. Social withdrawal. The fear of having a panic attack in social situations may lead to isolation and withdrawal from social activities, impacting the individual's social life and relationships. Support system. Building and maintaining a strong support system becomes crucial, as understanding and supportive relationships can significantly mitigate the impact of panic disorder. Overall quality of life. Emotional well-being. Living with the constant threat of panic attacks can contribute to heightened stress and anxiety, negatively impacting emotional well-being. Limitations. Individuals with panic disorder may feel restricted in pursuing activities they once enjoyed due to the fear of triggering an attack. Sleep and physical health. The emotional toll of panic disorder may affect sleep patterns and overall physical health, contributing to fatigue and other health concerns. Strategies for coping. Social settings. Disclosure and communication. Openly communicating with trusted individuals about the condition can alleviate the pressure associated with hiding panic disorder. Sharing coping strategies with friends or colleagues can foster understanding. Gradual exposure. Gradual exposure to social situations, starting with less challenging environments, can help desensitize individuals to triggers and build confidence over time. Professional settings. Workplace accommodations. Discussing potential workplace accommodations with employers, such as flexible schedules or a designated quiet space, can create a more supportive environment. Stress management techniques. Introducing stress management techniques, such as deep breathing exercises or mindfulness, can be discreetly incorporated into daily work routines. Relationships. Education. Providing educational resources to close contacts about panic disorder can enhance understanding. This may include information on common symptoms, effective ways to offer support during an attack, and the importance of non-judgmental communication. Couples or family therapy. Involving significant others in therapy sessions can strengthen relationships and provide a platform for shared coping strategies. Self-care. Establishing routine. Creating a structured daily routine can instill a sense of predictability and control, reducing the likelihood of triggers. Regular exercise. Physical activity is known to alleviate anxiety. Incorporating regular exercise into the routine can have a positive impact on both mental and physical well-being. Mindfulness practices. Engaging in mindfulness practices, such as meditation or yoga, can help individuals manage stress and stay present in the moment. Coping mechanisms. Practical strategies for managing panic attacks. Mindfulness techniques. Grounding exercises. Focus on your senses by identifying and describing elements in your surroundings. This helps anchor you to the present moment. Mindful breathing. Pay attention to your breath, inhaling and exhaling slowly. Concentrate on the sensation of each breath to promote calmness. Deep breathing exercises. 4-7-8 technique. Inhale quietly through your nose for a count of 4. Hold your breath for 7 counts, and exhale audibly through your mouth for 8 counts. Diaphragmatic breathing. Practice deep belly breathing by inhaling slowly through your nose, allowing your diaphragm to expand, and exhaling fully. Progressive muscle relaxation, PMR. Body scan. Systematically tense and then relax each muscle group, starting from your toes and working your way up to your head. This helps release physical tension associated with panic attacks. Creating a personalized panic attack toolkit. Identify comfort items. Carry comforting items, such as a soft blanket, stress ball, or a small object with sentimental value, to provide tactile reassurance during moments of distress. Emergency contact list. Compile a list of trusted contacts who are aware of your condition and can offer support. Include professionals, friends, and family members who understand your needs during panic attacks. Guided imagery or audio. Include calming audio clips or guided imagery sessions on a portable device. Listening to soothing sounds or guided relaxation can redirect focus during an attack. Positive affirmations. Create a list of positive affirmations or calming phrases. Repeat these affirmations during panic attacks to counter negative thoughts and promote a sense of control. Breathing aids. Keep small items like a stress relief ball or a small scented pouch in your toolkit. Associating calming scents or tactile sensations with your toolkit can enhance its effectiveness. Lifestyle modifications. Importance of a healthy lifestyle. Regular exercise. Engage in regular physical activity, such as walking, jogging, or yoga. Exercise releases endorphins, which act as natural mood elevators, contributing to overall well-being. Establish a consistent exercise routine to help regulate stress and anxiety levels. Balanced nutrition. Adopt a well-balanced diet rich in whole foods, lean proteins, fruits, and vegetables. Avoid excessive caffeine, sugar, and processed foods, as they can contribute to heightened anxiety. Stay hydrated, as dehydration can exacerbate symptoms associated with panic attacks. Sufficient sleep. Prioritize a regular sleep schedule to ensure sufficient and restful sleep. Sleep deprivation can amplify anxiety and contribute to the frequency of panic attacks. Create a calming bedtime routine and maintain a comfortable sleep environment. Stress reduction activities. Yoga and meditation. Integrate yoga or meditation practices into your routine to promote relaxation and mindfulness. These activities enhance self-awareness and reduce the physiological responses to stress. Attend classes or use guided online sessions to learn and incorporate these practices effectively. Mindfulness practices. Practice mindfulness in daily activities, such as mindful eating or mindful walking. Being fully present in the moment can alleviate stress and enhance overall mental well-being. Explore mindfulness-based stress reduction, MBSR, programs for structured guidance. Hobbies and leisure activities. Engage in hobbies and activities that bring joy and relaxation. Whether it's reading, painting, or gardening, dedicating time to enjoyable pursuits contributes to a balanced and fulfilling life. Identify activities that promote a sense of accomplishment and satisfaction. Frequently asked questions, FAQ. What is panic disorder? Panic disorder is a subtype of anxiety disorder characterized by recurrent, unexpected panic attacks. These attacks involve intense fear and physiological symptoms resembling the body's response to imminent danger. What are the common symptoms of panic attacks? Common symptoms include increased heart rate, muscle tremors, sweating, feelings of impending doom, and a sense of detachment from reality. A panic attack is defined by experiencing at least 4 of these symptoms simultaneously. How does panic disorder impact daily life? Panic disorder can significantly impact various aspects of daily life, including work, relationships, and overall quality of life. It may lead to challenges in concentration, increased absenteeism at work, strained relationships, and limitations in pursuing enjoyable activities. Are there risk factors for panic disorder? Panic disorder may have a genetic basis, with close relatives of individuals with the condition exhibiting a higher risk. Early life stress is also considered a potential trigger. Women are twice as likely as men to experience panic disorder, and the onset of symptoms typically occurs around the age of 25. How is panic disorder diagnosed? Diagnosis involves ruling out medical conditions that mimic panic attack symptoms through comprehensive medical examinations. A mental health professional conducts a thorough evaluation, considering family and psychiatric histories, stress levels, and substance use. What are the treatment options for panic disorder? Treatment options include medications, such as antidepressants and benzodiazepines, and psychotherapeutic approaches, including cognitive therapy and behavior therapies. A combination of medication and therapy often proves most effective. Can panic disorder be prevented? While preventing panic disorder is challenging, individuals diagnosed with the condition can take steps to reduce the frequency and intensity of panic attacks. Lifestyle modifications, timely diagnosis, and appropriate treatment interventions play pivotal roles. Conclusion. In conclusion, panic disorder, characterized by recurrent panic attacks, poses challenges to various aspects of an individual's life. Understanding its manifestations, causes, and available treatments is crucial. The multifaceted approach to managing panic disorder involves lifestyle modifications, coping mechanisms, and a combination of pharmacological and psychotherapeutic interventions. By addressing the impact on daily life and implementing strategies for coping, individuals can navigate the challenges posed by panic disorder and work towards a better quality of life. Early diagnosis and a comprehensive treatment plan contribute significantly to long-term relief and well-being. If you suspect you or someone you know is experiencing panic disorder, seeking professional help is essential for an accurate diagnosis and tailored intervention. Your health matters. Quali.health